Brazil's COVID-19 crisis is also getting worse by the day. The country has confirmed its first official case of the more infectious variant uncovered in South Africa. Thousands of people are dying every day from the virus. Over 340,000 people are now known to have lost their lives there.
More bad news for Brazil. Surging COVID-19 cases have put the healthcare system on the verge of collapse. Patients are dying in and out of hospitals while they wait for treatment. Ventilators are scarce. Frustration is growing. If they had properly prepared for this scenario from the beginning, then the same thing wouldn't be happening again. They should have prevented it from the beginning, and it would have been better. But now, it's not. I have already lost relatives to the coronavirus. I think the politicians should be more united. For months, President Bolsonaro has opposed strict measures to curb the virus and slammed state leaders who imposed tight restrictions. Even his own COVID-19 infection did not change his approach to the pandemic. P1, a new variant, has emerged and spread quickly in Brazil, making it the epicenter of the pandemic again. Whether P1 has the potential to lower the effectiveness of some vaccines is unclear. Meanwhile, Brazil has also just recorded its first confirmed case of the highly contagious variant first discovered in South Africa. Forecasts by some epidemiological institutes show that Brazil will most likely surpass the 500,000 mark for COVID-19 deaths, rapidly approaching the total number of deaths of the United States, the country that had the highest absolute number of deaths. Brazil has been slow to vaccinate. On Wednesday, the Pan American Health Organization said the country needs access to more COVID-19 vaccines and called on countries around the world to help.
Let's look at some other developments in the COVID-19 pandemic worldwide. A court in Brazil has suspended the extension of drug patents. The move could lower the cost of drugs to treat COVID-19. It follows failed global attempts to waive vaccine patents. Argentina has announced a 3-week nighttime curfew after infections reached a new record high. It starts on Friday in the capital and other badly affected areas. And New Zealand has now suspended all travel from India. This comes after India reported a record number of new cases in one day. It's struggling under a new wave. Well, experts are blaming large gatherings for India's outbreak. Nearly 127,000 cases were reported there on Thursday. That's the highest number ever. Prime Minister Narendra Modi urged eligible citizens to get vaccinated while he received his second COVID-19 dose today. India is trying to scale up its vaccine rollout, which has only reached a small fraction of the population. Modi's government has refused to impose a second national lockdown to curb spreading infections, but he's set to meet virtually with regional leaders who will decide on restrictions. Here's DW's Manira Chowdhury in Delhi with more.
India is now well into the second wave of the pandemic. We are seeing a huge spike in the number of cases every day. In the past couple of days, India has also surpassed a daily tally of 100,000 cases in a single day spike. Now, this has created an alarming situation. Most of the states are issuing fresh guidelines and restrictions, including Delhi, the national capital where we stand right now. Delhi has now imposed a night curfew. That means there will be restriction of movement from 10 in the night to 5 in the morning and only movement of essential services. And those people who are going to get themselves vaccinated will be allowed, that too with an e-pass. Now, what are people thinking? Are they concerned about this fresh spike? What do they think about the night curfew? And are they worried that the country can go back to a state of a nationwide lockdown? Let's find out.
Yes, we are a little scared looking at the rate of infection. Already the mark of 100,000 single-day cases has been crossed. I am concerned of how much it can spike further.
Night curfew is a pretty good idea because generally people work in the days and then they come back. So unnecessary going out and catching up with people can be restricted.
If they want to impose a curfew, they should do it during daytime, when more people are out there compared to night, and the chances of infection are also more.
There is definitely a sense of urgency. Experts are saying that the spread of the second wave is much faster than the first one, and that has people concerned. There's also a growing demand for making vaccination available for all age groups. People are anxious. And while many of them believe that restrictions like a night curfew are important, they're not entirely sure how effective such measures can now be in curbing the spread of the second wave.